My name is Sola Olawore, and I'm a doctoral student in epidemiology at the University of North Carolina at Chapel Hill. I received a PhRMA Foundation Predoctoral Award in Value Assessment and Health Outcomes Research. I would put my origin story as a population health researcher specifically as when I attended a talk as a pharmacy student about alternative career paths for pharmacists based on our skills and our knowledge. And I think that was the first time I heard about epidemiology and specifically pharmacoepidemiology. I kind of applied for an internship in the National Health Service where I got my hands on epidemiologic research, where we actually kind of did an audit on prescription patterns of general practitioners in a particular region. The results from that little audit informed policy in that region at that time. And I felt very proud of the work I'd done. I was like, little old me, the work I did in the summer kind of contributed to something. And so I think that kind of cemented my change in trajectory from like clinical pharmacy and working in a retail pharmacy to doing research full time. So I think that was the turning point for me for sure. In my research lab at UNC, we evaluate the safety and effectiveness of medications given to pregnant women during the perinatal period. For my PhRMA Foundation funded research specifically, I will be using machine learning methods to predict the gestational week's specific risks of imminent delivery. And I will also evaluate the safety of an important intervention for improving outcomes among preterm neonates, antenatal steroids. So antenatal steroids are given to pregnant women to help with the development of the lungs and help breathing right after birth. The success of a lot of interventions, including antenatal steroids given to either prevent preterm birth or improve outcomes following preterm birth, is determined by actually receiving it and then when you take it relative to delivery. So for antenatal steroids specifically, it is recommended that pregnant women receive the intervention within 7 days of delivery. But a lot of women that actually receive the interventions do not deliver within the 7 days, only around 1 in 4. 50% actually go on to deliver a term. Antenatal steroids work better when the woman receives it within 7 days of delivery. And if a woman actually receives it and goes on to deliver a term, it is linked with a lot of poor neurodevelopmental outcomes in the neonates. So my research will aim to use machine learning to actually identify a phenotype for women who are going to deliver imminently. So this will help us identify women that will benefit the most of the intervention, and we prevent either over-medication where the preterm neonates that come after that are increased risk for neurodevelopmental outcomes, or under medication where some people do not receive it at all, even though they need it. A second prong of my research is basically trying to create an eligible population of women at risk, and so that we can compare outcomes between the women that are similar, that have the same risks at baseline, and then compare what happens if they receive and if they did not receive the outcome, and see how that impacts the long-term effect for neurodevelopmental outcomes for the neonates. For me, I embed a lot of like small wins into a lot of my work every day. So it's something as simple as like having a to-do list for the day and completing the to-do list. It's like as easy as that. I think it kind of gives you the needed, dopamine boost for you to like continue the next day. And I think that is important. Like I feel like research sometimes can feel very nebulous. What you're trying to achieve can feel very nebulous, but having like small tasks that you can kind of chip away at as you're getting towards the big goal is important for motivation. A lot of people that come into research definitely have the type A personality and they feel like they should have all the answers at all times. But I think that being okay with not knowing the answer kind of makes you open to learning. And I think it makes you a good researcher at the end of the day, because researching is definitely finding the answers to things that you're not aware about. I am hoping to stay in an area where I'm kind of helping generate evidence on the safety and effectiveness of medication, particularly in populations that we don't see being talked about in research a lot, or populations that we don't have a lot of clinical trials for. So people with rare diseases, children, older adults, pregnant women, things like that.